day to all our SBAH Radio audience. My name is Mncedisi, also known as FMsquared say, Mfano Pumangale, Mpumalanga, Mzinopotes Rava, Kwandebele. Today we will be discussing the upcoming National Patient Experience of Care Survey 2025. This important survey will happen from the 4th till the 15th of August 2025, focusing on how patients feel about the care and services they receive at our hospital. Joining us in studio today is Ms. Hlongwane from the Quality Assurance at Biko Academic Hospital. Ms. Hlongwane, good day.
Good day, Mncedisi, and thank you so much for the invite. I really feel honored to be here, and also good afternoon to your listeners. And you guys are doing a great job. I follow you on Facebook, and the information that you share is valuable, and I'm learning a lot from you guys, so thank you.
And thank you as well for honoring the invite, for being with us today. Thank you. Let's get right into it. The first question is, can you briefly explain to us what is the National Patient Experience of Care Survey?
So the Patient Experience of Care Survey, it's a survey that we conduct annually. This is an initiative from a National Department of Health. So we conduct it in the second quarter of the financial year. So this is the time that we give our patients an opportunity to give us feedback on the care that we've given to them. So we just want to know their experience. And when we look at our patients' right chapter and Batobili principle, it talks about consultation and participation of patients. So it is part of the consultative process that we follow to engage with our patients.
Who is expected to participate, and how will your department make sure that the patients know about this upcoming survey?
So the people who are going to participate, it's our patients, people that have had access to our services, and the people that need to participate is patients that they are able to represent themselves. Legally, I can say patients who are able to give consent, because this survey is voluntary, so patient needs to give consent and to participate. But we don't leave also the patients who, for other reasons, they are unable to participate due to maybe they are very ill, or the children. So the family or the next of kin in that regard will be the one who are assisting them to participate in the survey.
Can you also tell us what will happen if ever your department doesn't manage to conduct this survey on time, and if it didn't do the survey, are there any penalties that might face your department?
So there isn't actually penalties that we are going to face, but as an institution we are going to be regarded as non-compliant, and this survey is actually mandatory that we do it.
Mm-hmm. How will the feedback from the survey be used to improve the patient's care at Biko Academic Hospital?
The information is, the feedback is going to assist us in improving our service. Isn't it that the patients are going to give us feedback, and we good or bad? So in areas where maybe they, indicate that they are not satisfied, we will look at those areas and make sure that we develop the service delivery improvement plans to address those issues. And we are going to look at also the pressure points or the gaps that they are noting, and the survey will also assist us in the planning of our services that we offer here at Biko. And the survey, as you mentioned in the beginning, that it's a national. So this survey is not only conducted here in Biko, but it's also conducted in all health facilities in the public sector. So it will also assist the department in terms of planning of services. So it also assists us, but also assists the Department of Health as a whole.
Talk about dissatisfaction. When it comes to dissatisfaction, if ever a patient reports that maybe one of the staff members badly treated them, how does your department come into play in that matter?
So as quality assurance, we play a big role in terms of attending to patients' complaints. So if a patient complains that, a staff wasn't friendly to me or was rude, ill-treated me in some sort, we usually go and investigate. We interview the staff, get information of what has really occurred. And after our investigation, if we need to refer the staff maybe to a wellness program, we do that. In some cases, we also make sure that corrective measures are being applied, and give feedback to the patient also what corrective measures we have applied in order for the patient to be happy at the end of the day.
In closing, are there any last words that you would like to add on the upcoming event, survey?
So actually, Mncedisi, you asked me how are the patients going to know about the survey.
Oh yes.
So I didn't actually answer you on that. So you can see I'm wearing a yellow t-shirt, Cabo Yellow. So we are starting with making patients aware of the upcoming survey. So as you can see, I'm wearing a yellow t-shirt, and in July we are starting with our giving out information to the patients in our service area. We'll be engaging our patients, making sure that they are aware of this upcoming survey. We are going to put up notices on notice board, information to tell them about the survey and the process that is going to unfold when we conduct the survey. And I'm here today with you. This is part also of making sure that the patients are getting information of the survey. So on that week of the survey, there will be full force. You will see most of our staff will be wearing a yellow color t-shirts. Management will be walking around, making sure that the patients know about the survey. We'll see decorations in terms of balloon in entrance areas, and we'll be having also our staff there welcoming the patients and telling them about the survey and make sure that they participate in the survey.
Thank you for your time. That was very informative, Ms. Hlongwane. You've heard it there, Steve Biko. My name is Mncedisi Maseko, and you will tune in to the #1 podcast, that is SBAH Radio. Do make sure you follow us on our social media platforms at Facebook, TikTok, and YouTube. That is at SBAH Radio. The link is on our bio. Do make sure you hit the subscribe button, like, and follow. My name is Mncedisi Maseko, signing out.